not going to come near this, and that is why proteins do not get filtered. So the factor is the negativity. So now what is being filtered? This is whatever is being filtered is called ultrafiltrate. What is ultrafiltrate? That is plasma minus proteins and lipid bound substances. What is the osmolarity of the filtrate? It is the same osmolarity as the plasma, and that is 300 milliosmoles. Then what is the ratio of tubular fluid concentration and the plasma concentration? That is a very interesting one, and you would actually see many questions which would ask you this. What this means is, when the filtration is occurring, so let's say 10 sodiums come into the glomerulus and 10 waters come into the glomerulus. Remember, sodium and water are very good friends. So 10 sodiums come in and 10 waters come in. Out of those 10 sodium, 5 sodium go into the nephron and 5 water go into the nephron. What is the relative concentration now? Into the plasma, equal number of sodium and water, and into the nephron, equal number of sodium and water. So regardless of the number of molecules, the ratios are the same. So if you divide them, if you divide these two, the answer will be 1. What does that mean? There is this, that there is 10 by 10. So let's say 10 is sodium and 10 is water in the plasma, and then in the Bowman space is also 10 by 10 or equal by equal, 5 over 5. If you now divide them, 10 by 10 divided by 10 by 10, the answer is going to be 1. So this is what is the tubular concentration, and you would actually see, a chart like this, and we'll explain that later, in which there are substances which are going like this, substances going like this, substances going like this, and so on. This chart will be the important key to understand, and we'll go through that chart when we get to that. But anyways, the ratio of the tubular fluid and the plasma fluid concentration of substances is very important to know. What are the substances which are freely filtered? Sodium, chloride, bicarbonate, potassium, these are freely filtered, no issues. Metabolites, glucose, amino acids, organic acids, for example ketone bodies, especially in case of diabetic patients. Metabolic waste products, urea and creatinine. Non-natural substances, inulin, para-aminohippuric acid. Proteins, insulin, proteins and peptides, insulins and myoglobins, these can be filtered as well. Not freely filtered. So what substances do not filter? Proteins do not filter. Lipid bound substances, for example T4, bilirubin, etc., other hormones, they do not filter. So remember this is an important list to keep in mind. Let's continue. Factors which are affecting the GFR and filtration fraction, we talked about it. Filtration fraction is actually GFR divided by renal plasma flow. GFR divided by renal plasma flow is called the filtration fraction. Normally it is about 20%. Do you know what fraction really, what is the fraction? Fraction means part of the whole. So what is GFR? GFR is the substance which has been filtered into the Bowman capsule. What is renal plasma flow? The flow of plasma inside the kidney. So out of all that plasma which entered the kidney, how much went into the Bowman spaces? That will be the filtration fraction, right? So filtration fraction normally is 20. Normal GFR is 120 milliliter, normal renal plasma flow is 600, so if you divide them, 20% is the filtration fraction. We talked about it. Filtration fraction is dependent upon flow. Low flow, greater filtration fraction. Higher flow, lesser filtration fraction. Don't forget that. You can actually use that here as well. Similarly, factors affecting GFR, pressure is a primary factor and the flow is a minor factor. We'll talk about these topics in detail later. Okay, so that is that. Let's see what is next. So sympathetic nervous system causes vasoconstriction, afferent and efferent both. So what would happen when you have the vasoconstriction of both afferent and efferent? GFR due to reduced pressure, so pressure will reduce, GFR is reduced, increased flow because the increased filtration fraction because the flow has reduced. Peritubular capillaries, so this is what is happening in the glomerulus. What is happening in the peritubular capillaries? Do not forget the partner of the glomerulus. Who is kidney's partner? Lungs. Who is glomerulus partner? Peritubular capillaries. So increased reabsorption due to lower capillary hydrostatic pressure. So that is very simple. When you have a low flow, the fluid is already less, then there is more filtration as well, so the fluid which is going into the peritubular capillaries is less. That would mean relative concentration of proteins will increase. That will mean the oncotic pressure would increase and reabsorption would increase, which makes sense, right? For a patient who is under low pressure system, do you think that he should just have increased filtration and then things should just be wasted out? No, we need to pull them back. So we should pull them back with more force, just like we are filtering them more, and that is because the oncotic pressure has increased. Angiotensin II, we talked about it. Efferent arteriolar constriction is the angiotensin II. Prostaglandins, efferent arteriolar constriction is the prostaglandin. So we'll do that chart later, but again from a fundamentals point of view, these are very important things. Glomerular pressures and peritubular pressures, an effect of flow and effect of pressure. Filtered load, it is the rate at which the free substance X not bound to proteins is filtered. I think let's take that up in our next topic. At this time let's close it here. In this topic what we covered was hemodynamics, and the dynamics need to be known both in the glomerulus and in the peritubular capillaries, and we talked about effect on afferent arteriole and efferent arteriole and what happens with increased flow and less flow and increased pressure and less pressure. Okay, so we will continue. Thank you very much. See you next time. Bye bye.